morning, everyone. Thank you so much for joining us for our Industry Professionals Roundtable. I am Amy Washam. I work with Northwest Missouri State University as the director of our Kansas City location. And we are so delighted to have our guests here with us today. Before we dive in, I just want to tell you a little bit more about the organization called the Northland Education Business Alliance. We are members of this organization, and the purpose of our organization, NEBA, is to promote Platte and Clay County opportunities for students and teachers to learn more about the industries local, so we can keep all of our young people local to our communities and to continue to develop our workforce. So we are delighted to have our expert panelists with us today. And before we kick off, I want to give a special thanks to Mr. Brett Kisker from the Northland CAPS organization. He's going to be running our technology today, as well as the Q&A panel. So don't forget, as we're going through, feel free to pop your questions into the Q&A section of the Zoom webinar. We'll be delighted to ask those to our guests after we do introductions today. We also want to thank the Clay County Economic Development Council, especially Julie Lewis that's here with us today. She is providing us with the technology and has done such a great job of getting us connected to the local community. So we thank the Clay EDC for what they're doing to help us. And our friends at Platte County EDC are on our other session with additional colleagues from NEBA with us today. So to kick things off, we thought we would just give our panelists each an opportunity to introduce themselves, what organization they're with, and tell us a little bit more if they have certain things they wanted to convey about their jobs. So Camera, would you like to go first? You'll have to unmute, I'm sorry.
You would think I would be better at that by now. My name is Camera Meany. I work at Truman Medical Centers as a special programs manager. I've worked here for approximately 6 years now. I serve a dual role where on the outside of the hospital, I do government relations, public policy work. On the inside, I do pipelining programs, specifically focused on diversity and within our nursing departments.
Fantastic, thank you so much. Wendy, would you like to go next? And you'll have to unmute.
Hello, my name is Wendy Newberg. I'm the Executive Director at Benton House of Tiffany Springs. I actually teach level 1 med aids here at Benton House. I teach CPR here at Benton House, and I hire certified nurses aides, residential assistants, and we're just very excited to have students coming here and educating them, and I'm just very excited to be a part of this panel today. So thank you.
Thank you so much. We really appreciate you bringing the lens of the long-term care facility.
Yes.
So when we did our virtual career expo last time, we were like, that was something we could have added too. So thank you so much for being here.
Absolutely. Absolutely. Thank you.
Darren, would you like to go next, please?
Hi, I'm Darren, and I'm a talent acquisition partner sourcer here at the North Kansas City Hospital. And it's good to be part of this to talk about, the future of our workforce and, the things that we see in our applicants. And, I got out of recruiting for a couple of years. I'm back in it, and it's changed drastically and some things that people are doing. So it's good to be part of this and talk things through.
Thank you very much. And Tony?
Yeah, I'm Tony Phillips. I'm the Director of Strategic Alliances for Liberty Hospital. My role is somewhat twofold, is business development, making sure that we are expanding the hospital and hospital resources as much as possible and when feasible, and then business optimization. My role is to kind of take all of our resources of our hospital, from physicians to staff to community relationships, and make sure that we're optimizing all of those resources for the care of our community.
Fantastic. Thank you so much. Just as a quick reminder, we do have the Q&A button at the bottom of your screen in the middle, so feel free to submit questions along the way, and we'll be happy to ask our expert panelists here. We will be concluding at the 9 o'clock hour, so we do have plenty of time for lots of great questions. This morning, I thought I would kick us off and give each of our panelists an opportunity to answer. Why is it important for everyone in the community to help build our future workforce? So we would love to hear your lens of that, as well as maybe some very specific examples of your collaboration in those efforts. Camera, would you like to go first?
Absolutely. I think we all have to kind of change our mindset to where we can't remain siloed in Kansas City and be successful. We have to find a way to connect with one another. So what is beneficial for education is also beneficial for development and healthcare. It does help establish those pipelines. And I think once we start to see things through that perspective, we can all be more successful. At Truman, as a community hospital, I mean, we engage with all types of businesses and industries, specifically our engagement with our K through 12 schools. I think that is, it's essential for us in order to keep nurses and other healthcare professionals coming into the hospital. We also try to partner as much as we can with other local nonprofits. At the end of the day, we're all serving the same population. So for us, building that community engagement, building that community network is what keeps, it's essentially what keeps our doors open at times.
Fantastic, thank you. Wendy, would you like to go next?
Absolutely. And I'm glad that you included us as a part of this, because we're kind of the forgotten part of nursing. We're kind of the part that we're the continuity of care. So after the hospital, oftentimes the patients come to us as part of, they go to rehab, and then oftentimes after rehab, the seniors need a place to go, not necessarily maybe skilled, but they'll still need some assistance. And that's where I come into play, where the assisted living part, where maybe they can't go home, but they still need somewhere to go. And so, you know, grandma, grandpa, mom, dad, whomever need to come to have some assistance to be somewhere where they're safe to live. So we're kind of the forgotten part of healthcare, the assisted living part. And so we still need nurses, we still need caregivers, we still need people in our part of the world in nursing care. So, yeah.
Thank you so very much. And I personally have had many loved ones that have had a long-term care need. And so we definitely appreciate the love and the care that goes into those things that you do, as well as all of the care provided by all of our hospital partners as well, especially during these very, very busy times. We're very fortunate to have all of these folks with us today. Darren, would you like to let us know why it's important to help build that future workforce?
Well, thinking about broadly in terms of Kansas City in general, you know, we have to think about our city and are we continuing to grow ourselves as an attractive city and a place to be and to work at. And thinking about if there's educators that are listening at this point, I mean, it's important that they continue to emphasize the careers that are out there. And selfishly, I'll talk about healthcare careers, you know, nurses and, you know, and RTs, respiratory therapists, but just to make sure that we're planting the seeds in their minds of all the different career possibilities so that when they graduate, they're aware of what's out there and they could begin to take the steps to make a career that's, you know, good for themselves and for their families.
Absolutely. Thank you so much. And Tony, we'll have you wrap this question on your perspective of why it's important to have everyone involved.
Well, I think it's important. I think from a hospital perspective, we have a responsibility to serve and support our communities, and whether that's through programs like CAPS or anything that helps us build our future workforce. I think so. One, the responsibility to serve. I think for, you know, selfishly, I think it allows us to build a quality workforce. It allows us to reach out and kind of develop and support people that, you know, possibly would become employees of our hospitals. And then lastly, there's no better, you know, there's no better player in the community than us to report how things have changed and how positions have changed and how job and roles have changed over the years. And so it helps us keep, you know, our future workforce educated on, you know, the differences of the job from where it was 10 years ago.
Fantastic. Well, from this point, I will turn it over to Mr. Kisker. And it looks like we've got a few questions rolling in from the audience, and then we have a few additional questions ready. So Mr. Kisker, it's up to you.
Yeah, so actually, I want to go off script just a little bit because now I've heard this message twice between Darren and Tony talking about how things have changed in the last 5 to 10 years. If we could touch on that, because we do have a question, but I see, Wendy, that you're on our end, we can see that you're typing out an answer. So we'll leave that one in the chat so we can go. And again, guys, if you're listening in the audience, use that Q&A. This is a time for you to interact with the panelists, you know, in a way that you can get answers to specific questions that might be on your mind. But Darren and Tony, I'll let you start off with this one, and then we'll fill in with the other two panelists. But how have things changed, and what do you see as maybe the things that, if I'm a teacher in the classroom right now, what are the things that I should be communicating perhaps to my students about those changes, and what you guys are looking for? What it, you know, takes to be successful in the healthcare field right now?
So what my perspective would be more from the administrative standpoint. And I could tell you that historically, you know, hospital administrative positions were kind of, how do I say this, is just more operational. And now what I would tell you is, you know, 15 years later, that, yeah, there is operations that need to be taken care of, but leadership and guiding teams and really looking into the building of the future of healthcare and where it's going and trying to be out ahead of that is extremely important. So it's not just all about operations anymore. I think there's some real strong leadership that's going on that has to go on if a hospital is going to be out in front of, you know, all the changes that are constantly happening in healthcare.
Well, what I'm seeing, because I left recruiting, working compensation for a few years, and then came back to recruiting. So that's, I think, what my passion is. But what I've noticed mostly is that candidates these days tend to ghost, if I may use that term in this group, but, you know, where they schedule calls, schedule interviews, and don't show up. And at the risk of sounding like an old man, back in, you know, these days, you would just make a phone call, but now you can text me, you can send me an email, you know, and it's just important to be professional in your interactions with all with all employers, because eventually you may come back, you know, to that employer, and there'll be, you know, in your application file that, you know, this person didn't show up for an interview. So that's not a very good mark on your career. And I also think about people in terms of opportunities. You know, when you get an opportunity to work for an employer and it doesn't last for more than 6 months or a year, it's just thinking about that opportunity to work and gain experience and make the best of it, but then to leave because of personal issues. I know we have personal things that we have to work out, but it's always important to seize your opportunities and keep going and make those things work for you. That's some of the things I'm just seeing, and as I'm coming back to recruiting. And then also with technology changing, with, you know, with now we're doing this instead of going to meetings, we would all get together. Now we're doing this online and doing Zoom meetings, and knowing that technology and, you know, when you go into the workforce, to understand how Zoom works or WebEx, and to use that, and to, you know, not have the excuse of, well, it's not working for me. Just, you know, just to understand technology and how to interview. That's what I'm seeing right now.
I'm even finding that when I'm hiring in professional roles, meaning my management roles, the people are not showing for interviews and not even corresponding with me that they're not going to show, which I'm kind of surprised about. I mean, yeah. I kind of expect it at a lower level, but not at a management level.
And I will say, I mean, I'm fairly young. I don't know what things were like 10 years ago. But I will say, I mean, I've been here for 6 years, and I've seen the change in technology. I've seen the change in generational perspective. And I feel like I can say this because I am a millennial. We handle things differently. We see things differently. And sometimes that reflects that maybe we're not as professional. Maybe we aren't as personal as other generations. And I hear that a lot with our directors, that individuals in my age range, they struggle to truly communicate with one another, with their peers, with the patient. And so there's that part of it. But I will also say COVID's going to change healthcare forever.
Right.
And we don't even know what that's going to look like. I mean, it's been less than a year and things are completely different now. So I think we have to give a lot of consideration to this really is a moving target. We don't know what it's going to look like when this is all over. I think the one that we can probably all agree on, though, is that we all need staff. We all need not just bodies, we need compassionate individuals, both on the clinical and non-clinical side, to really keep things moving. COVID has really revealed all these things that all of us probably already know were in existence. And now we can figure out how to handle them. And we can't just do that siloed by ourselves. We have to find a way to truly engage students now so that we're prepared 5 years from now.
Those are great responses. So let's say that I'm a teacher in the classroom right now, or I'm a building administrator, whatever role I'm playing in education, and I'm working with students. If you guys were going to offer advice to me as an educator or to the educators in our audience, what courses or maybe experiences or concepts, what would you want us to be covering to help give our students a leg up if they wanted to go into the healthcare profession? What are the things that you would be looking for in, say, a new employee?
I would like to, thinking about, again, going back to technology, just because a lot of what they do is charting and understanding the computer systems of entering in patient data, pharmacies, vital signs, things like that. But then also thinking about the passionate customer service, I firmly believe when I talk to people, I'm listening. Are they emphasizing that they're going to take care of that patient or that customer, whoever they interact with, because it's so important that we care, in healthcare for people, have empathy and passion and patience. So that I think that's really important. That's characteristics I'm looking for. And then just science is important, obviously, and mathematics. But then again, I think it all just comes down to your passion and what you want to do. And because there's so much to do in healthcare, it's not just doctors and nurses. There's respiratory therapists. There's information technology professionals, and data is becoming important. Data is driving business to be able to make decisions, for our leadership. So there's a lot of things you can do in healthcare. It's not just, like I said, doctors and nurses.
I think one of the things that I've seen is this development of people in healthcare that aren't necessarily providers, they're not necessarily nurses, they're not necessarily CNAs. I mean, there are people that are getting into healthcare that are, from a business standpoint. So I think, giving a well-rounded experience, I think, is important. I think that's the beauty about the CAPS program is that students can get out and they can experience those things for themselves. And, because I think we've all seen somebody who had an idea of what they wanted to do and what career they wanted to do. And then if they go experience it, then maybe they find out that that's not really what they thought it was. And so I think providing the real world experience with the students is probably the most ideal thing, and then let them direct their path from that.
And I'll say, Tony was just speaking about me. I was going to be a history teacher, and somehow I landed in healthcare. And I mean, I wouldn't change it for the world. I had no intention. I am not clinical at all, but I still have a leadership role in how things function here at the hospital. So on top of what Darren said, obviously science, math courses for us, that foreign language is really, really important. If we can get someone who is a nurse, is a respiratory therapist doing PT, OT, who can speak Spanish, that's fabulous. If we can get someone who can speak Arabic, that's priceless. Those types of things so that we can communicate with our patients and make sure that we're providing the best care possible. I mean, that's so impactful. I will agree, the real world experience, the shadowing experiences, the volunteering, those sorts of things, I think that really gives students an idea of what healthcare is. It's not just doctors and nurses, but nursing is not just nursing. Being a doctor is not just being a doctor. There's so many things that those professions do that are non-clinical that we need individuals to engage in.
Wendy, you kind of jumped on the next piece of this.
Yes.
And you answered it in the chat, but let's go ahead and answer that one live, because that's a good one that I think is probably worth discussing. So I'm going to pull that question back up. How much emphasis as an educator should we place on employability, like soft skills, versus technical skills geared towards, the medical profession or the business side of being in the hospital setting, or whatever setting we're talking about with being in healthcare? So if you want to start off that one and we can kind of go around the horn, that would be great.
Well, in our world, in assisted living, you wear many hats. So in fact, yesterday I got to sit in and do some mock interviews. And one of the questions I asked was, if I asked you to do a job such as vacuuming the lobby, would you say that's not your job? And every single one of them said, yeah, I'd say that's not my job. But in this world, it is your job. And they were like, what? I'm a CNA, but in assisted living, it's your job. And in fact, when people walk through our doors, many of them don't even know how to run a vacuum. They don't know how to do laundry. They don't know how to deal with family members, answer a door with a smile on their face. So those are important skills that you need to know, is just how to have good customer service and how to be that person, whatever that resident needs, whatever that person needs, you have to be that person in healthcare. And even if you're in a doctor's office setting, in a clinical setting, and rooming a patient, you have to be able to do that. And some people don't know. I mean, I've even gone to my own physician. They don't know I'm a nurse myself, and they don't know that, and they don't have that good rapport, that good bedside manner. So that's important to teach people, that, even a person in a hospice setting, that person, you still have to explain to that patient, okay, I'm going to lift your hand up and I'm going to wash between your fingers. You still have to communicate with that person and teach the CNA or teach the caregiver that you have to talk to the patient and talk through each thing you're doing to them. So I don't know that that's taught as much, but it's important to do that, I think. And it's important to teach skills such as just basic home economic skills as far as vacuuming and laundry, and it's important to teach customer service and smiling and kindness and empathy and things like that. Absolutely. Mm-hmm. And it's not really clinical, but it's important to teach those things, because they are going to need those in their skills as a nurse or in the healthcare field. Mm-hmm.
I think it's important as professionals and people and personally to model the way, because Wendy, you're right. I mean, there's so many things that I think about when I started, I didn't know, and now that I know, and to be willing to share that knowledge, I think it takes people to have that patience and understanding. Because Kamara, you're right. It's a different generation, and I've worked in another organization where every year we hired new analysts straight out of college, and it was challenging, but it was fun, because you got to pick their brains, about what's really going on out there, and got giving new concepts. But it should be mutual, in the sense that both sides want to learn from each other. So I think that's really what's important, to just make sure that we're modeling that way and having that patience to learn and also to teach and show the way.
Absolutely.
I agree. I also think it's important to, and I know this is something that's really hard to teach, seeing the big pictures, being able to critically think about processes. And I think especially in healthcare, you can't just see a patient for their diagnoses. You have to look at the big picture and
Right.
how social elements fit into their care. We talk a lot about social determinants of health. We have to get the staff engaged. If there's things that happen outside of the hospital or the long-term care facility that impact the care that happens inside. So getting individuals to correlate that with what's going on with the patient, I think that naturally leads to being empathetic to what is going on in the patient's life.
Yes.
You're muted, Tony. all that knowledge, you're going to have
I'm
to start over
sorry.
again.
Well, there
Here
was
we
no
go.
knowledge coming out of there, but from commercial standpoint, I'll piggyback. And if COVID has taught us anything, is that in using the term she uses, is everybody's role is no longer siloed, meaning that a nurse is not just a nurse anymore. And so we not only have to be able to expand our skills at the drop of a hat, but I think the other thing that we've all learned and we've all seen is that everybody has to find value to their role, to their organization on a consistent basis. When things change, such as COVID, and we hit a pandemic, there were tons of people within Truman and North Kansas City Hospital and living care, facilities that they had to expand their role and they had to bring value in different places. And so I think those soft skills are extremely important, because now you have to expand your role to where maybe on Monday you're a nurse, but maybe on Tuesday you're screening people as they come into the building. And so I think, one, having the ability to expand your skills outside of your normal role, but also having the awareness that you have to bring value to your organization in no matter what silo it is.
Right.
What I'm not a panelist, so I shouldn't really be speaking here, but what you also hit on there is you have to be humble enough to accept the role that you need to fill in for, the day. If it is screening patients, like just going and doing it because that's what's needed to be done. Yeah,
Absolutely.
Yeah. Cameron, this question is actually directed specifically to you. So if you don't mind expounding a little bit on this, the language proficiency piece that you mentioned earlier, does that need to come from native speakers? Because it's difficult to imagine a scenario where high schools are going to have kids that are proficient enough in speaking a different language to use that in a professional setting. Have you seen any experience or what's your insight on that?
I mean, native speakers are fabulous. We could have native speakers. I think that's always preferable. It's just easier to navigate that way. And I think when I say get them engaged in foreign language, get them engaged in foreign language early, get them engaged in foreign language in K through 12. So when they do get to the collegiate level, they can hit the ground running and can become potentially, well-versed in whatever language it is that they're working towards. It's one of those things, and maybe this isn't the case at every hospital, but at least for us here at Truman, our population is very diverse. We have so many Spanish speaking and Arabic speaking patients, and we don't have the staff or the interpreters to be able to always be there at the bedside in that moment to ensure that they understand the care they're receiving as well as their family. So like for me, I speak some Spanish. I've been pulled into patient rooms before to do my best to translate things. You don't have to necessarily be proficient, but understanding and being able to hold a conversation with patients is everything. If you're a native speaker, even better. And I think with that comes a little bit of a conversation about the diversity of the staff that we are needing to start recruiting, specifically here at Truman, so that we can have staff that can look and communicate with our diverse patients, because evidence-based research shows that improves patient outcomes every single time. So between those two, between the communication aspect and the diversity aspect, those are the kinds of people that we're really trying to recruit, and we're trying to recruit them early.
I don't know if you'll have the answer. I'm kind of putting you on the spot here. I don't know if you'll actually have the answer to this question, but I want to go ahead and ask it anyway.
All right.
Do you find that kids that take, let's say that I'm growing up in one of these suburbs, I'm at North Kansas City School District or Park Hill or Liberty or wherever, right? I'm up here somewhere in the Northland, and I'm taking Spanish in high school. Do you find that students that are taking Spanish in high school, maybe a class or two in college, is that enough fluency to build on? Is that enough of a foundation to build on, or do you think that maybe we need to do a little bit more? Or does my question make sense? Like, is that enough, I guess, is the question.
I mean, I went to Fort Osage. I went to a suburban school where I took Spanish, and I took 2 years of Spanish in college. And I will say, no, it's not enough to always hold down a conversation. But I will say, in that pinch, it's enough for me to be able to communicate what I need to communicate in that moment. I've always encouraged, I'm a wife of an educator, and so I'm always telling him, you need to start the kids in a foreign language earlier. We have to do our best to make them proficient. So the earlier that you can get them exposed to that, and it's not just putting them in a classroom, it's how do we get them in those real world experiences where they are hearing the language being spoken in real life. I think those kinds of things are invaluable. Now, I will say, I know that North Kansas City is a very diverse school district, so I'm going to presume that there's a good amount of native speakers that are within the district that could also potentially be serving as a buffer for some of those students. Hopefully the other students are hearing them speak in their native language. But the earlier you can expose them, the better. I mean, my son's 4, and we're going to start putting him in, he's going to learn French. And that's what he's going to do at 4, because I know that it'll be easier for him later on in life. So can North Kansas City offer Spanish in kindergarten? I don't know. Would it be helpful? I think in our world, even outside of healthcare, absolutely it would be. Does that answer your question?
Yeah.
Okay.
Yes, it does. Yeah. Thank you.
Welcome.
Hey, Bright, can I go off script real quick?
You can go off script.
I've been sitting here and I've been thinking about all of you and where you are and your different locations. And I was just kind of reflecting on, you see people at their absolute worst days and their absolute best days, just that wide emotional spectrum. How do you even begin to prepare employees for that roller coaster of emotion? You know, person in room 15 got the worst news, and person in room 16 welcomed a new member, a baby to their family. Like, how do you even begin to prepare people for those interactions?
I believe it starts in, did someone start? Did I cut someone off?
No, you're fine. Go ahead.
Okay. I believe it starts with, the compassion in the person, but then as they start to go through school and do their clinicals and have interactions, in their clinicals and with the leadership nurse, the educators, and showing that way of how to care for patients, and then it develops further. When you start in nursing orientation or as a doctor or pharmacist, as you start to see patients and interact with them. And me just being in human resources, when I see, it's known when you see a patient down the hall, they're in that situation and you just want to stay out of their way, or if they're standing there not knowing what to do, find help for them just to make sure they can get what they need, to get to that unit as a family member. I think it's just all of a kind of like a community thing as we further and become exposed to healthcare, that we all see that and react to that in a positive way, so people can adjust. And because you're right, you're in all states of mind, when you come here as a patient or as a family member.
I agree. I think you have to get them to see both sides of it. I will tell you, for example, I recently came back from maternity leave, and my first day back, we lost 3 patients from COVID in my 8-hour shift. And I was just hearing the codes go off and I was getting emotional. I can't imagine what it was like to be on that unit taking care of those patients. And so I think you have to find that balance between days like that and the days where we have, like you said, triplets born on labor and delivery, and how they weren't supposed to survive, but they did. So getting staff to see that balance. I also think it falls on the organization to make sure that we are doing what we can to ensure the wellness of our staff. And whether that is something as simple as making sure the nurses get to use the bathroom that shift, or whether it's creating like a meditation room for them. Part of that falls on us, And you have to create that culture within your organization so that when students do come in, when we have our nursing students, when we have our allied health students come in to do clinical rotations, that they're seeing that that's a part of what the healthcare culture is. And that's something that's very hard to accomplish, but I think it's something we have to continue to strive for.
I think it's just a different balance. I think it's a balance of training. I also think it's a balance of the hospital making sure that their employees are feeling the compassion and that every patient has a story. If 15 patients walk through the main entrance, there's things going on that we don't know, from somebody walking in to see their relative for the last time to somebody going in to greet their newborn infant. So that's what we try to do. We try to just really preach the compassion of not knowing what the person's going through and treating them all the same.
In our world, we kind of form very close bonds, not only with our staff, but with our residents. So if we lose anybody or if anybody gets COVID or anything, it's very hard on us. So we always do kind of Spirit Week kind of things. We try to do things to boost morale around here a lot. In fact, we have Spirit Week right now with the Chiefs. Everybody's dressed up. And we kind of do those kind of things because if it affects one of us, it affects all of us all the time. So we try to do those kind of things. But yeah, I mean, it's different in our world, but definitely there are challenges all the time here every day. And, they walk in the door and they have things that are very real to them and their problems are very real and they're hurt and they feel pain every day. And, they bring it to work sometimes and they're upset about this. And then we have family members that come to the door and they're very upset and they're upset they can't see their loved one and they can't come in our building. And so we have different challenges than you guys see at the hospital, but yeah, definitely there's high emotions everywhere. There's high emotions when you go to Hy-Vee, when we go to the grocery store, because things are different in our world as well. We can't live a normal life either. So.
And your celebrations probably look a little bit more like someone that's finished their rehabilitation and they're headed out the door. So you probably don't have the infant side, but hopefully you're able to celebrate those moments with those individuals that are feeling much better from the help of your care.
All right, let's go. I'm off script here with the questions that I know that we sent you beforehand. I taught engineering classes for a number of years, and I was always fighting the misconception that in order to be an engineer, to even think about a career in engineering, you had to be like the 36 on an ACT, 4.0 GPA, super involved, like live and breathe math and science kind of person. That was the type of personality that it took to be successful in engineering. Shift that to healthcare. What kind of, there's going to be a baseline for any profession, obviously. Like you have to have some skills in order to be successful in the field, but does it take the genius to become a doctor? Do you have to be a 4.0, 36 on the ACT type in order to be successful with a career in healthcare? Or are there other factors that are maybe more important to you just to get in and to find a life that you love, a career that you love, that you're going to be really successful at?
Well, I think we can start thinking about, there are ways to, I'll think about my past. So I started at Children's as a unit secretary because I thought I wanted to be a doctor. But then as I saw doctors and what they had to do, I'm like, nope, that's not for me. But then I started looking at nursing and got a call. Then I started looking at nursing and respiratory therapy and just all the different professions that are there. And just open my eyes. So I guess what I'm trying to say is that you can look at entry-level positions, in the hospital, because you have environmental services, food service, and nursing unit secretaries and patient care techs. You don't have to get your CNA. So it's just about, getting your foot in the door of healthcare and just seeing what's out there. But but definitely thinking about, as you do that, what kind of skills and courses am I going to need to take to get to become that doctor or the nurse, the respiratory therapist or pharmacist.
I definitely don't think that there's a perfect equation. I can't speak necessarily on the preparation of the education and the requirements and things like that, but my advice would be is don't close yourself out to any profession. There's a lot of leadership in healthcare now that if you look at their resume, they weren't in healthcare before, and maybe their leadership skills promoted them or provided them the opportunity to develop programming and business development or growth or operations inside of healthcare. So I don't think you're to end up in healthcare. I don't think you have to start from the very beginning. But I do think there's some skill developments as far as from a craft. If you want to be a physician, if you want to be a nurse, I think that starts young and early, but I wouldn't close yourself off to any profession.
Cameron or Wendy, would you like to chime in, or we want to go to the next one?
I mean, I agree with everything they said. I mean, obviously there's certain things you have to do to, become a doctor or a nurse. But I mean, I've seen some really high performing students come in and really struggle. So I really think it's more about, yes, you have to work hard, but are you passionate about what you're doing? Because I think that makes up a huge gap when you're actually hitting the floors and taking care of patients.
Well, I tell the students, I took a path much like they did. I took a dual credit class at 16 in high school, did the CNA course, became a nurse very young. Nursing is multifaceted. I didn't know what kind of nurse I wanted to be. I tried this kind of nursing. I tried that kind of nursing. I did job coaching as a nurse for a short time with people with disabilities. But they don't have to take a linear path like straight to, like I had ambitions to be a nurse practitioner, but doesn't mean you have to take a linear path to this part of the career. And then, things happen in life. I became a young mom, and I took, my son had cancer very young, and I took a break for 2 years, and you just don't know what's going to happen in life. And then I became a DON, and I was a DON for many years. And I got out of assisted living and went into pediatrics, of all things, totally off the path, and then became a DON again, and then decided I'm going to be an administrator. So, just you don't know where your career is going to take you. And so I just tell students, just follow where you feel like your heart goes. And maybe you want to go into this. Oftentimes the students will say, I want to go labor delivery. I heard that a lot in pediatrics, labor and delivery. And I'm like, okay. But maybe once they get into it, they maybe won't want to go into that. Maybe they'll want to go into a hospital setting, or maybe they'll want to go into senior care. Sometimes people come work for me and, or in a senior setting, and they love it. Sometimes they come work in a senior setting and they don't like it so much. It's not for them. Memory care is not for them. And that's okay. And it's okay they don't like med surg. I don't like emergency room. I don't like it. It's not for me. It's just, it's different world, and it's okay to try different things in nursing. It's okay to go somewhere else. It's okay to not like medicine. It's okay to go into administrative part of the medical world. And it's okay not to get straight A's. Nobody looks at the doctor's resume and says, okay, did you get straight A's? Let me see your grades that you got in high school or college, when you go get your physician. So I tell students, don't beat yourself up on that, because that's okay. So, it's just a different path, and it's okay whatever you take. Medicine is multifaceted. Nursing world is multifaceted. So
it's a great message of persistence you just gave there. persistence and keep exploring, because if you hate the job that you're in, that doesn't mean you have to leave healthcare. That means there's going to probably be something else in healthcare that you could be interested in. You just got to, it's experience, isn't it? You know?
Absolutely.
Speaking of that, then this is a very broad question that was just posed from the audience. So I hope that we answer the question the way that you're asking it here. How much experience is needed to get into healthcare at the entry level?
0. I mean, there's jobs you can, and I think Darren alluded to this earlier, there's jobs you can do in healthcare that required no healthcare experience at all. I mean, I came in with no healthcare experience at all. And it's just like Wendy was saying, we all have different paths, and you can always find something within healthcare to be a part of. So it's essentially, it's whatever you really want to do. There's a way to get there.
I have literally hired people that have walked up to my door with kindness and friendliness and a big giant smile on their face and said, I just need to work somewhere. I want to work with people that are seniors, and I want to show kindness and caring. And I'm like, okay. And they have been wonderful employees. Mm-hmm.
And I think about as you go through your organization, your hospital. So if you start in food service or, you know, in a certain department, that you start learning those soft skills. You network with other professionals, and as you're doing your job, you're doing your best so that you're laying a foundation of good performance. And as you move through, it's going to be easier on you with good attendance, good performance, and doing your job the best you can. Professionally, and showing others that you have the ability to adapt and grow and provide the best for your organization or hospital.
Darren, I'm glad you said something about attendance, because that is so important. And when they, you know, they're like, well, but I had this going on at home, which I tell my staff, I'm very empathetic to what is going on in your life. You also have to look at the domino effect of what happens when you call in here or don't come to work here, because you've affected so many other people's lives. You know, people are sitting waiting to go to the bathroom. They're waiting to go down to dinner. They're waiting to have their bed changed. They're waiting for a shower. All of these things, you know, at the hospital setting, they're waiting to be turned over. They're waiting for a wound change, whatever.
Right.
But you're not seeing that happening. And then your fellow peers, your coworkers, are having to double up on their workload because you called in for whatever reason, whatever was the magnitude of things in your life. So
Right.
in our setting, they have to find their own replacement if they can, you know, I mean, of course, if they are driving to work and their arm falls off, that's an emergency, but, you know, we ask that they find their own replacement. So I try to hire a large PRN pool because of those reasons. Like, it's just a huge domino effect if you call in of what happens to the other people. So
Your teammates, your coworkers,
yes.
and the patient, the bottom line, the patient or the business is impacted by that.
Yes. And then, you know, it angers your coworkers when they see you on Snapchat, you know, out having fun when you called in, you know, and they don't understand that. Or, you know, when you're texting whoever's on call at 1 o'clock in the morning to call in, you know, well, that's not really appropriate to do. But again, it's the generational thing, you know, the texting at 1 o'clock in the morning versus being able to call in the next day or that morning, X amount of hours prior to. So, yeah.
I agree with all of that. So if we want to move on, we can.
Yeah, let's do move on. Another question from the audience. And I see, Cameron, that you answered it in text, but maybe this is worth, again, bringing up just verbally. Courses in high school and college that you should take. Any recommendations there? Because everybody says lots of math and lots of science, but what does that mean?
In the text, I think there's just basic courses you have to get into certain programs. And so it could be as simple as biology, chemistry, anatomy, some algebra coursework. And again, it also depends on the program you plan on entering, and not exclusively from, I want to go to med school to I want to go to nursing school. there are so many nursing schools and nursing programs in Kansas City, and there's some of them require coursework that others don't. So it's really about understanding perhaps what school you want to attend early on so that you can prepare yourself ahead of time. I know most of the programs have counselors and advisors you can speak to that can help guide you to the right coursework that you may need depending on what your ultimate goal is.
I'm a big believer that whether or not you want to be a physician or a nurse or medical staff, that having it at the least basic business knowledge is extremely important. I was in patient care for almost 20 years before I transitioned into hospital leadership, and so part of my experience was on the job training of just trying to learn the business aspect. But I see a lot of young physicians that are out that obviously there's only so much time in the day, and you have to get your skill and you have to learn your trade. But I think having business knowledge, the physicians that have that background seem to be a lot more successful, seem to be a lot more in line with the organization than the physicians that have very little business background, and that all they know is their patient skill. Obviously, we need patient skill to be the ideal and the most important thing to take care of our patients in the community. But the one thing that I've seen is just that gap of having the business knowledge, and the success of the physicians that do have that seem to be a big gap.
Tony, I'll have to agree with you on that, because when you have an understanding of just base business of accounting, just the basics, not spreadsheet and sheets, but of accounting and economics, and potentially how to just business in general, that's very helpful. I mean, I was a sociology major, so I started in business, so luckily I had a few business classes on my belt. But then it's so important to know about that, and I've said this about technology, but to know a little bit about Excel or know what data is and how to get that data, and just some basic analysis. It's amazing what, when you look at, for example, turnover and why people are leaving. I'm just going to keep this real high level. I don't want to bore anybody, but, and just to see why are people leaving, and just have some analysis and react to that, like you're saying with COVID, and why people are leaving with, the impact of it. Just quickly make analysis and decisions and keep your business going strong. That's very important. Business is important.
On the math side of things, do jobs in healthcare, do they require calculus? Is it college algebra is typical? Does it vary by profession? Where on the math side of things do you see kind of the barrier being, or the baseline, I should say?
I'm not a nurse, but I know they have to calculate a pharmacy, when the ratio of drugs and the dilution. But diluting drugs and, weights and vital signs and analyzing that. So I think mathematics is pretty important in that sense.
I might just pipe in from the higher ed side. When Camera was talking, I was kind of thinking about this too. She mentioned checking out that having the student take that next step and checking out that program's minimum requirements is huge. And I thought, while I have a captive secondary audience, I would just put this plug out there. Across the state of Missouri, and I know not everyone stays in Missouri, but across the state of Missouri, the higher ed institutions have kind of reformulated those minimum math requirements. And so college algebra isn't really like the vanilla go-to anymore for all majors. And so especially if you're looking into the world of dual credits, so they're getting college credits in high school, if they can start thinking about those next level programs, that's really going to help guide them, because many of programs are now saying maybe statistics is like a little more, some of those analyses of does this information and data matter? So I would just put a shout out to having them dig in a little bit deeper, ask some really good questions of that certifying program or degree program ahead of time before they're enrolling, because just because they have college algebra doesn't mean they don't end up having to take the other math course whenever they go into a specific program. And so, yes, we'll look very carefully at those next steps before enrolling.
I just thought of something about critical thinking skills. You know, it's important to be able to constantly ask questions that when things happen, and thinking about patient care, you know, my patient's, you know, blood pressure is down. I'm just throwing up, and being able to answer those questions and think through it to see what are all the possibilities that I can do. So I think that's important to be able to ask questions and be critically think and be an advocate for care, you know, and to make sure that things are cared for your patients.
All right, and the final question is just an open-ended one. As we wrap up the panel, 3 minutes left here, I'd like to go around the horn one more time, and Wendy, we'll start with you. Final thoughts. If there's one thing that you want this audience to take away from this panel, what do you think that one takeaway would be?
That one takeaway I would say would be, I would say follow what you feel like your path is going to be. Like they said, like Amy had said, look into what the criteria is for college courses, because you don't know where it may be that you need to take different mathematics. Definitely take some critical thinking courses, because you're going to need that no matter where you go. You're going to need that in, you know, if you take a bar test, you're going to need that in NCLEX testing. You're going to need that in an administration testing. To advance in any kind of career, you're going to need that. That's my takeaway on that. So.
I started writing down some things, but I think adaptability is the key word. Just, you know, if you, and seizing opportunities. So like, as I mentioned, you know, every job you get, every experience you have in the workforce and in life, just to learn from it, keep growing, and keep your eye on the future about what you see yourself doing and what you want to do, and just go for it.
I agree with what's been said. Don't restrict yourself and think you have to fit in a one size all bubble. You know, there's so many opportunities within healthcare, and even for the educators out there listening, you obviously chose education, but come inside healthcare. Here at Truman, we invite the educators to come in and see what healthcare is, so that you can help prepare your students for all these opportunities. So, I mean, consider that as well. I mean, do some exploring, get engaged, get that real world experience, even if it's just for one day, one shift. See what's out there for you.
Yeah, I'm just piggybacking. I think the important thing is it's to find your passion, but find your passion through those real world experiences. Go out and experience it. Go out again, because we've all seen so many young people, you know, think that they know what a career is and find out that's not really what it is, or that's not what they expect. But I think it's about finding your passion through real world experiences. But most importantly, don't be afraid to change paths. Don't be afraid to you know, have an opportunity arise and it changes what you kind of envision for your entire career. There's going to be times that life changes, opportunities arise. Sometimes the industry that you're in changes. Again, find your passion, but don't be afraid to take a change of path.
Thank you so much, everyone. Camera, Wendy, Darren, Tony, I have learned a ton today. I'm sure our audience members as well. We really appreciate, we know how chaotic things are right now for all of you. And this is a huge chunk of your day that you've taken out to join us. So we're very appreciative. To our attendees, at the end of the session, when you begin to log off, you'll be prompted to complete a survey. We hope you take the time to fill out that survey so that we can get additional feedback and continue to offer great opportunities like this. So feel free to give us feedback on this session or additional ideas that you might have for the future. We're happy to continue to serve you. Thank you for Julie Lewis at Clay County EDC for helping us get this all organized. And Brett, you are the Tech Man of the Year. I'm so happy you're on my team today. So thank you everyone. Be sure to check out, we do have a YouTube channel that this will be posted on. So check out Northland Education and Business Alliance on YouTube. Be sure to subscribe. All of our virtual Career Expo sessions from last fall are on there, and sessions from today. Since you're in here, you won't be able to be in the other parts, so feel free to peruse those. And always check out nebaworkskc.com for more information about us. So thank you everyone, and have a great rest of your day.